For people diagnosed with cancer in Canada, surgery, radiation, and chemotherapy have been the traditional treatment routes for a long time. But now, hospitals are making major breakthroughs in diagnosis and treatment that are challenging the power of this disease once had. And one of them is known as precision medicine. So joining us this morning with more is the medical director of early cancer detection at the Princess Margaret Cancer Centre, Dr. Raymond Kim. Welcome to the show. Exciting to have you here for this story.
Great, thanks for having me.
First of all, for people who aren't familiar with the term, what is precision medicine?
So precision medicine is a concept for patients where we match the drug, we match the treatment for the actual patient rather than the disease. So a lot of it hinges on genetic testing and understanding the patient's disease in a very in-depth manner, so we can match their therapy to really treat them with the most minimal side effects.
Yeah, and one example of what's emerging in the area of precision medicine is called next-generation sequencing. So how does that work?
So next-generation sequencing is a new way that we can analyze the genetic material of a patient. So when we did the Human Genome Project about 20 years ago, in 2003, it took about $3 billion and took 20 years.
Wow.
So the sequencing technology back then was called Sanger sequencing and various other technologies. And now we have something that's called next-generation sequencing, which uses sophisticated different methods such as light and protons. And those methods allow us to sequence a patient's genetic material very quickly. So now it takes maybe a couple of weeks.
Wow.
And a couple $1,000s. So we can return all of this wealth of genomic information back to the patient.
Now, looking ahead, you believe that the new frontier for cancer treatment is going to be found in a patient's blood. Why is that?
Yeah, so the patient's blood is a very interesting genetic entity. I work with a lot of genetic counselors, and today is Genetic Counselor Awareness Day.
Okay.
And we usually use the genetic material in the blood cells as the inherited genetic material. So that's one component of the blood that we use to implement precision medicine. But now what we're seeing in cancer patients is when cells turn over in the body and you spin down a blood tube, not only can you isolate the DNA that are in the living cells, but there is DNA that floats to the top of the blood, which is known as cell-free DNA. And cell-free DNA can be used in various types of health contexts. We use it in, my prenatal genetics colleagues use it in measuring the pregnant woman's genetic material of the fetus, because the fetus sheds that DNA into the mom's blood.
Right.
And what we see in cancer patients, a similar concept happens, where the tumor sheds bits of genetic material as the cell grows and dies and becomes a tumor. So we think that by examining a patient's blood in this cell-free DNA, we can actually determine if a patient is developing cancer and detect cancer early, or monitor the cancer treatments, and importantly, also understand what is happening inside of the tumor cells to match the therapies with the most minimal side effects.
You know, you and I were speaking before this interview about how exciting it is for somebody who's been in research for so long to be working when some of these developments are happening. But let's talk about patients for a moment. You know, cancer is very personal. It touches almost every person in this country, directly or indirectly. What does this mean for the patients who are part of these trials?
Yeah, so I'm a medical geneticist, and I deal with patients who have a strong family history of cancer. And those are, you know, families who have the BRCA1 gene, and there's about 100 different genes that cause inherited forms of cancer, such as this Angelina Jolie gene. So what's really rewarding is that we deal with families with strong histories of cancer. And most of the parents are very concerned about their child and their cancer trajectory. And to be able to ameliorate a whole family's cancer journey is very rewarding, because otherwise, if the technology wasn't as sophisticated and so rapid, it would take generations for people to see that.
Yeah. But they know that this is, the treatment potentially for one of their offspring is not going to be the same as it was for them.
No. With these genetic technologies, we know that the surest path for cure in cancer is if we detect cancer early.
Yeah.
So the quicker we can diagnose and the earlier we can diagnose a cancer, we can actually cure it by cutting it out, providing very high-definition therapeutics to really treat it well with those minimal side effects that otherwise were the traditional modalities that we did use.
It is so exciting and great to be able to talk with you about this today. Dr. Raymond Kim, thanks for coming in.
No problem. My pleasure.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.